Cocoa helps cardiovascular health, though the research team improves blood flow in diabetic patients if they drink it for a long time. A study found that drinking about 3 thick cups of cocoa every day can help prevent cardiovascular disease in diabetics. Dr. Mark Kelm's team at Aachen University of Technology in Germany announced in the latest issue of the Journal of the American College of Cardiology, JACC, that when diabetics were asked to drink cocoa for a month to find out how cocoa affects cardiovascular diseases, the damage to cardiovascular function has recovered to normal level. According to Alert, a medical paper introduction site, the researchers asked 41 patients with type 2 diabetes to drink 321ml of high-enriched cocoa and 25ml of low-enriched cocoa 3 times a day for 30 days in order to observe the long-term effects of cocoa on diabetics. Although the content of flavonols was different, the cocoa flavor and shape were the same. In this study, we measured the effect of highly concentrated flavanol cocoa on vascular function through flow-mediated dilution (FMD). FMD measurement is a method of indicating the ability of blood vessels to respond to changes in blood flow and is an index that can determine whether heart vessels are healthy. Usually, when FMD is measured in healthy people of the same age as the study subjects, the arterial diameter shows expansion power up to 5.2% on average. High-enriched cocoa is effective for vasodilation. When consumed 3 times a day for a month, the researchers measured the patient's blood vessel function before drinking cocoa and made them drink it again 2 hours later. In this way, the blood vessel function before and after drinking cocoa was measured, and the results were examined 1 day, 8 days, and 30 days later. Prior to the start of the study, patients with type 2 diabetes had a severely impaired FMD response. The patient's arm arteries expanded by 3.3% before drinking cocoa, but FMD by 4.8% 2 hours after drinking highly concentrated flavanol cocoa. This is the result of a single day of drinking cocoa. The mean FMD response hours after the patients drank highly concentrated flavanol cocoa 3 times a day for 8 days improved from 4.1% to 5.7% before drinking the cocoa. After 30 days of drinking cocoa, the FMD response showed a fairly high level of improvement, ranging from 4.3% to 5.8% before drinking. In response to these results, Dr. Kelm explained, cocoa flavanol components improve the FMD response by increasing the production of nitric oxide. Nitric oxide has excellent effects on blood vessel protection, such as helping to maintain normal blood vessel conditions in the body, suppressing the progression of arteriosclerosis, countering the action of vasoconstrictors, and interfering with platelet aggregation and adhesion. The cocoa used in this study was not contained in chocolate that could be bought in regular supermarkets, but was a thicker flavanol cocoa than the average daily intake of 20-100g at home. The findings do not just mean that people with diabetes should drink a lot of cocoa at home, but that continuous consumption of flavanol can be a way to prevent heart disease, he added.